From the U.S. Department of Justice says too many people who need mental health care in Louisville unnecessarily end up in hospitals or jails. And it's placing the blame right on Kentucky state government. So our Ian Hardwitt tracked down Kentucky Governor Andy Beshear, who was in Louisville today, with more on how he plans to move forward under the federal government's watch and where else people getting mental health treatment can go.
That said, we are reviewing the report because we hadn't heard from the DOJ in over 11 months. An entire General Assembly session went by in that, where we even tried to create one of the teams that they have suggested in the report.
Kentucky Governor Andy Beshear believes the state's priorities will align with a Department of Justice report calling for top-to-bottom improvements of mental health care in Louisville. The federal findings put responsibility on the Commonwealth for bridging gaps in care. The report calls for more community-based support for people in a mental health crisis, like what's offered at 7 county services. Instead, the report says thousands end up in hospitals, then back on the street.
25 years, we called it the revolving door, which makes it sound better than it is.
Dr. Sheila Schuster of the Kentucky Mental Health Coalition says the state budget has money set aside for supportive housing, but requires approval from federal Medicare and Medicaid. That would provide a recovery space for people satisfying two crucial needs: a home and medical treatment.
People go in the hospital, and then when they get out, they don't always get connected to the community resources. And we've known that that's a flaw in the system for a long time.
It's why the DOJ says Kentucky's use of psychiatric hospitals is unnecessary. However, the report did acknowledge the city's expansion of a deflection program now providing 24-hour emergency mental health services. Responders prioritize community centers over hospitals when connecting people to care. In Louisville, Ian Hardwitt, WHAS 11, on your side.
Well, the governor pushed for state-funded intervention teams, which was recommended by the report in the legislative session budget, but it wasn't approved by the Kentucky General Assembly. In a statement, Senate Republicans did say that the governor's office failed to communicate Louisville's needs to them and that the General Assembly did give funding to mobile crisis centers.